Namaste, Khushamdeed. Welcome to this monsoon evening. I am Dr. Vinny Kantru, and you are watching Wednesdays with Dr. Vinny Kantru in Med Talks, the show which is a non-stop show, and we come to you every day with some good topic wherein we can provide health-related information to you. Today is our 728th episode and very important topic. आज हम बात करने जा रहे हैं विटामिन डी के बारे में। जी हाँ, विटामिन डी जो कि बहुत ही वाइटल न्यूट्रिएंट है, इट्स अ वेरी वाइटल न्यूट्रिएंट as far as the health of any person is concerned, and also in certain disease conditions it can be important. All this and something else. Before we go on to our main talk, we have to go on to the news of the day. So let's go to the headlines of the day. Vaidya RX is a health tech startup which is going to launch patient-centric mobile application offering patients, doctors, and retail pharmacies a platform that addresses prescription adherence and compliance issues. Now, whenever a doctor prescribes certain kind of medications, जब कोई डॉक्टर आपके लिए medications लिखते हैं, तो उस समय ज़रूरी नहीं कि हर पेशेंट वो जो प्रिस्क्रिप्शन है फॉलो करे और उस पे अडहेयर करे। तो ऐसा स्टार्टअप एक ऐप शुरू करने जा रहे हैं वैद्य आरएक्स, जिसमें इस चीज को एड्रेस किया जाएगा। द डॉक्टर सजेस्ट यूजिंग सनस्क्रीन बिफोर गोइंग आउट irrespective of the weather and time of the day or any season to reduce the skin cancer risk. Private hospital conducts Goa's first incompatible kidney transplant. This is a good news for the country. Recently here in Delhi also, there has been talk of many other organ transplants, and our country is going very forward in terms of medical health and all the transplants which are being done all over the world. This is a very heartening news. Everywhere we are starting new startups, we are doing much more which the other part of the world is also offering. Health Department plans to check the spread of post-flood diseases, which can include diarrheal diseases, viral fevers, malaria, and dengue in Prayagraj. We all know after the flooding and after the monsoons, there could be certain tropical fevers or these kind of related infections which can surge their head, and we have to keep a check on them. It is really good that the government is doing these processes in time. A new study established a potential link between loss of smell, blood clots, and new onset or maturity onset diabetes. So, this is very, very important. We all know that blood clots and the loss of smell has been related to COVID-19 viral infections. And also, we have seen certain people getting diabetes following the COVID-19 infection. Now, the vital part of our show today. Let's go to the topic of the day. आज का हमारा टॉपिक बहुत ही इम्पोर्टेंट है। आज का हमारा टॉपिक है विटामिन डी इन हेल्थ एंड डिजीज, एंड आवर गेस्ट इज इक्वली इम्पोर्टेंट and very well read endocrinologist who practices in Delhi. He's a senior consultant in the Indraprastha Apollo Hospitals, New Delhi. I welcome to the show Dr. Saptarshi Bhattacharya.
Thank you.
Namaste.
Namaste.
वेरी वार्म वेलकम, और हमारे साथ टाइम स्पेंड करने के लिए, अपना टाइम निकालने के लिए बहुत बहुत शुक्रिया। डॉक्टर भट्टाचार्य के बारे में बता दूं, ही इज अ सीनियर कंसल्टेंट एंडोक्रिनोलॉजी एट द इंद्रप्रस्थ अपोलो हॉस्पिटल्स, न्यू दिल्ली, एंड डायरेक्टर ऑफ e-health diabetes and endocrinology center in Noida. He is an executive committee member of the Endocrine Society of India and founder secretary of the Delhi Endocrine Society. He won the President's Award of Appreciation in 2021 from the Endocrine Society of India and has served as the president of the Society for Promotion of Education in Endocrinology and Diabetes, which is popularly known as SPEED. He has over 60 publications in peer reviewed and well read national and international journals. So thank you so much, Dr. Saptarshi Bhattacharya. And as you know, we are going to discuss today about vitamin D. So let's discuss about this very vital nutrient which has to be there in our diet. And I'm aware that especially for Indian people and Indian patients, it's really important to know that what is the importance of vitamin D. विटामिन डी क्या होता है और किस तरीके से ये हमारी रोज की जो रिक्वायरमेंट है पूरी होनी चाहिए और इम्पोर्टेंट है.
See, thank you, Dr. Vinny, for the kind introduction, and also a very good evening to all our viewers who have joined from all across India and also other parts of the world. So, vitamin D is slightly, it's a misnomer. So, it's not a vitamin. Vitamin, by definition, is something which is नॉट सिंथेसाइज्ड इन द बॉडी में नहीं बनता है, और वो खाने के माध्यम से हमें बाहर से लेना पड़ता है. सो दैट इज ट्रू फॉर ऑल अदर वाइटामिन. वाइटामिन ए हमारे बॉडी में नहीं बनता, वाइटामिन बी उसका बहुत सारे वेरिएशन है, वो भी नहीं बनता, विटामिन सी भी नहीं बनता. तो ऑल दोज विटामिन वी टेक फ्रॉम आउटसाइड. विटामिन डी इज समथिंग जो एक्चुअली हमारे बॉडी में सनलाइट से बनना चाहिए. सो स्किन के अंदर कुछ कंपोनेंट्स होता है जो ट्रांसफॉर्म्ड हो जाता है आफ्टर exposure to sunlight, and vitamin D is then produced partly in the liver, then further gets activated in the kidney. So there is a mechanism in the body which can synthesize vitamin D. So technically it's not a vitamin per se, but what happens is that, so there are multiple reasons. So जिसके वजह से विटामिन डी हमारे बॉडी में जो स्किन में जिस तरीके से बनना चाहिए उतना वो उस तरीके से बनता नहीं है, और हमें बाहर से ही लेना पड़ता है. और विटामिन डी दो रीजन से बहुत कॉमन है. दो मतलब इट्स का इम्पोर्टेंस लास्ट एक दो डिकेड में वी हैव अंडरस्टूड इट्स इम्पोर्टेंस बिकॉज it's very prevalent. So deficiency of vitamin D is very prevalent. So जिनका भी टेस्ट होता है, अनलेस बाहर से विटामिन डी मिल नहीं रहा है, सब सारे रिपोर्ट्स में हमें दिखता है कि विटामिन डी का लेवल्स कम है. दूसरा, विटामिन डी का प्राइमरी रोल इज फॉर मेंटेनिंग बोन हेल्थ and musculoskeletal health. What we see is that there is a evolving role in other aspects like immunity, cancer, बॉडी इन्फेक्शंस. सो सब में ही विटामिन डी का कुछ रोल दिखा जा रहा है. सो विटामिन डी इज ए इम्पोर्टेंट विटामिन. नॉट पर से विटामिन शुड हैव बीन सिंथेसाइज्ड इन द बॉडी, बट फॉर सम रीजन वी नीड टू टेक इट फ्रॉम आउटसाइड. डेफिशिएंसी इज वेरी कॉमन एंड माइट हैव अदर रोल्स आल्सो.
राइट. सो ये हमारे खाने के किस पोर्शन में होता है, या कौन से ऐसे विटामिन डी रिच फूड्स हैं जो हमें ये प्रोवाइड कर सकते हैं, और उसी के साथ हमारे नॉर्मल लेवल्स जो हैं वो क्या होते हैं, और यदि कोई टेस्ट कराता है तो किन लोगों के लिए ये टेस्ट इम्पॉर्टेंट है, क्या हर पेशेंट में हमें टेस्ट कराना चाहिए. हमने आजकल देखा है कि लैब इन्वेस्टिगेशंस जब हम लिखते हैं किसी पेशेंट के लिए, what is being followed in many laboratories is a package wherein they get a lot of vitamins also tested. So क्या हर किसी व्यक्ति को विटामिन डी कराना अनिवार्य है, जरूरी है?
See, अगर देखा जाए विटामिन डी should ideally get synthesized in our skin from the sunlight, but there are multiple reasons. First of all, we mostly are clothed, so sunlight का जितने exposure होना चाहिए in an Indian skin to synthesize vitamin D, it will be like a full body exposure with at least for 4 to 5 hours, which is very unlikely to occur, and that too during the time between 10 a.m. to 2 p.m. सो स्किन में फिजियोलॉजिकली जैसे बनना चाहिए नहीं बनता, तो वी हैव टू डिपेंड ऑन फूड फॉर विटामिन डी. बट द इंडियन फूड का जो पैटर्न है उसमें बहुत ज़्यादा विटामिन डी नहीं रहता. सो इफ वी लुक इनटू फूड, सो इफ यू आर टेकिंग कॉड लिवर, और यू आर टेकिंग सी फिशेज, or if you are taking sun-dried mushrooms, so those are the only things which are actually rich in vitamin D and can provide vitamin D as a food source. So naturally देखा जाए इंडियन फूड में vitamin D बहुत कम है. So in many of the Western countries, foods are fortified with vitamin D. So we have oils which are fortified with vitamin D. In India, some of the oils are getting fortified. There are milks or even juice preparations which are getting fortified with vitamin D. कुछ एक आध इंडिया में भी आना शुरू हुआ है, लेकिन अभी भी ज़्यादातर most of our oils and milk products are not fortified with vitamin D. Even milk itself, it might contain a lot of calcium, but it does not contain vitamin D. So what we see is that whenever we get a routine, so most of the patients, what happens in our clinic or your clinic or most of the doctors, what they face is if somebody has got a routine checkup, vitamin D is a part of the package, and it invariably comes low. And so this is expected. So if somebody is not taking vitamin D supplements, or at least the prevalence of vitamin D in India is in the range of 80 to 90%, and even in Western countries also it's in the range of 65 to 70%. So it's very common, and we need to most probably take it as a supplemental form, like a tablet or an external supplement to replenish the sources of vitamin D which is deficient in our for our body.
Hi, Dr. Bhattacharya. I think in between we lost you, so maybe my connection or your connection was not working. So now it is working. Coming
So
on to our,
yeah, so should I repeat the answer, or the answer was audible?
yeah, it was audible in the end. We lost you, so maybe you were telling that our Indian diets are especially deficient in the form of those preparations which are usually found in the Western diet. जब हम अपना खाना वेस्टर्न लोगों से कंपेयर करते हैं तो यूजुअली जो हमारा इंडियन खाना होता है वो वेजिटेरियन होता है, उसमें बहुत ज़्यादा फिश का सेवन जो है वो नहीं होता, एक्सेप्ट जो हमारे तटीय इलाके हैं वहाँ पे फिश लोग खाते हैं। लेकिन इसके साथ ही हमें डॉक्टर भट्टाचार्य ने बताया कि जैसे नेचुरली हमारी बॉडी में स्किन में विटामिन डी बनता है, सब लोगों ने सुना होगा कि सनलाइट के एक्सपोजर से ये विटामिन डी बनता है और लोग कई बार सोचते हैं कि हम धूप में बैठ जाएंगे और हमारी डेफिशिएंसी जो है वो करेक्ट हो जाएगी, लेकिन ऐसा हर समय सच नहीं होता, क्योंकि जो लेवल ऑफ एक्सपोजर चाहिए होता है आपकी स्किन का वो इंडियन धूप में कई बार पॉसिबल नहीं हो पाता। हमारे यहाँ पे गर्मी होती है, इतना लेवल ऑफ एक्सपोजर हम नहीं कर पाते हैं। पूरी बॉडी का एक्सपोजर 4 से 5 घंटा सुबह के समय, जो कि 10 से 2 या 3 के बजे के बीच में है, ऐसे में अगर हम धूप में बैठ जाएं तो बहुत ही मुश्किल है। इसलिए ये डेफिशिएंसी हमारी कंट्री में बहुत ही कॉमन है। तो ये हमने देखा है, अगर इनवेरिएबली हम टेस्ट कराते हैं तो बहुत लोगों का डेफिशिएंट आता है। तो हमारे साथ काफ़ी लोग आज
एक
जी।
पॉइंट में और यहाँ पे आई वुड लाइक टू reinforce is that another reason which for which the vitamin D deficiency is getting it, लोगों को अभी लगता है कि vitamin D deficiency अभी पता चला है. So one thing is that we were not having test for vitamin D earlier, maybe around into 1990s or early part of 2000. Hardly anybody got tested for vitamin D. So the tests have been become more available in the last decade or last 15 years. And on top of that, another reason which is responsible for such widespread prevalence of vitamin D is pollution. So the pollution level in India is very high. The UVB segment of the sunlight has to reach our skin. So most of the UVB get dispersed while it has to pass through a very polluted atmosphere. So that is another reason which can partially explain that the vitamin D deficiency prevalence has gone up so much.
जी, सो हमारे यहाँ पे क्यों विटामिन डी डेफिशिएंसी इतनी ज़्यादा पाई जाती है, इसके बारे में हमें डॉक्टर भट्टाचार्य से पता लग रहा है, जो एक एंडोक्रिनोलॉजिस्ट हैं। हमारे साथ काफ़ी लोग जुड़े हुए हैं आज, उनमें से कौशिक चक्रवर्ती जी, अनामिका अनु, रामेश्वर सिंह पनवर जी, अंकुर सिंह, केदार जोशी जी, सब लोग हमारे साथ हैं। और जैसे कि आज हमें पता है गणेश चतुर्थी है, एक बहुत अच्छा मौका है और आप सबको भी गणेश चतुर्थी की बहुत-बहुत शुभकामनाएँ। डॉक्टर भट्टाचार्य की बातें सुन के सब लोगों को अच्छा लग रहा है, वो हमें बता रहे हैं कि किस तरह ये टॉपिक एक इम्पोर्टेंट टॉपिक है और इसके बारे में सुनना इन लोगों को पसंद है। कुछ क्वेश्चंस मैं अभी कुछ देर में लेना चाहूंगी। यदि जिन लोगों का जो हमारे साथ जुड़े हैं कोई सवाल है तो प्लीज आप कमेंट सेक्शन में अपना सवाल लिख लीजिए। मैं आपके सवाल जरूर डॉक्टर भट्टाचार्य से करूंगी। हमने ये जाना कि डेफिशिएंसी बहुत कॉमन है। नॉर्मल लेवल्स यूजुअली कम पाई जाती हैं हमारे पेशेंट्स में। ये हमने अडल्ट पेशेंट्स के बारे में बात की। अब आते हैं बच्चों और प्रेग्नेंट फीमेल्स पे। ये एक बहुत ही इम्पॉर्टेंट एज ग्रुप है, चाहे वो प्रेग्नेंट फीमेल्स हो जिनके अंदर एक और जान पल रही है, या फिर जो बच्चे हैं जिनकी ग्रोथ हो रही है। जैसे आपने कहा कि मस्कुलोस्केलेटल सिस्टम के लिए विटामिन डी इज वेरी वेरी इंपॉर्टेंट। तो ये दोनों जो लोग हैं, क्या इनमें भी डेफिशिएंसीज हो सकती हैं, और इनमें से किन लोगों को ट्रीटमेंट की जरूरत पड़ती है?
See, again, this is a very, very important question. It's a very common situation. So, actually, even mother's milk. So, we know that in the first 6 months, the ideal food for a baby is exclusive breast milk. Even that is also not sufficient in vitamin D. So, what we see is most of the pediatricians they will recommend around 400 units of vitamin D every day through a drop formulation to the infants. So right, there is a role of vitamin D supplementation starting from infancy till death. So vitamin D is required. So unless somebody is getting exposed to sun in the way I told, maybe a Caucasian because they have less pigment in the Western population, they have less pigment. They synthesize vitamin D quicker from the sunlight. Maybe they will require an exposure time of 15-20 minutes, or and they also go to beaches more regularly, they sunbath more regularly. We don't have that cultures in India, so maybe there are reasons they get more vitamin D. In Indian setting, it's so very common and it's required at all stages. So the that you need to discuss with your pediatrician or your doctor that कौन से stage में कौन सा vitamin D चाहिए. But even in infancy, during breastfeeding, vitamin D should be given to an infant. And then you raised a very important question of pregnancy. So, pregnancy, there are numerous studies which do show that even pregnant women are deficient in vitamin D. But as a rule, we try to avoid supplements and calcium and iron during the first trimester. So that is a protocol that is being followed. So only very, very essential medicines are given. So during first trimester of pregnancy, we usually withhold vitamin D. But as soon as the lady goes into the second trimester, जैसे 13th week शुरू हो रहा है, most of the gynecologists will start vitamin D preparations also. So usual recommendation is like if somebody is not deficient, the maintenance dose will be somewhere around 800 to 1000 units. Sometimes we see maybe the person might require a slightly higher dose. But if somebody is deficient, we usually correct it and give a higher dose. So pregnancy, second trimester, third trimester, vitamin D is required. Good for the mother, good for the baby, good for both bones of both the mother and the baby. And for a growing infant, starting from infancy, even in the exclusively breastfed stage, till the complete development, and also further on, vitamin D supplementation is required because we see it very, very common. And if you are giving a low dose of vitamin D, you had asked a question, we had missed that whether tests are required. So most of the guidelines will recommend around 1000 unit of vitamin D is required for all of us. That is the daily recommendation requirement for an adult. It's not that कि हम कोई दवा दे रहे. So 800 या 1000 unit of vitamin D is actually the daily requirement in the for it that should be present. That is a recommended dietary allowance. So if we are eating roti chawal, or if we are eating dal, we are eating a protein, we are not thinking we are having a medicine. So that should have been there in the food. Somehow it's not there. It's essential for our bone, it's essential for our muscles, it might have other important functions also, so it has to be given from outside. And so it's not that there is any harm of नहीं हम कोई medicine ले रहे हैं हमें कोई side effect हो जाएगा. It's not like that. It's a very simple dietary constituent which is for some reason not there and we need to take it from outside. Dr. Vinny, you are muted. Dr. Vinny, you are muted. Yeah.
सॉरी, मेरा माइक म्यूट था, उसके लिए माफ़ी चाहती हूँ। यदि किसी को विटामिन डी डेफिशिएंसी हो गई है, ये डिटेक्ट हो चुका है, तो उनके सिम्पटम्स क्या होंगे? या क्या उनको जो है उनके बॉडी पे असर आ सकता है? और एक बहुत ही अच्छा सवाल पूछा है इंदर कामरा जी ने, वो पूछना चाह रहे हैं, क्या विटामिन डी डेफिशिएंसी से डिप्रेशन भी हो सकता है?
So again, a very important question. So I will take it in two parts. So vitamin D, अगर frank deficiency है, so we used to have rickets in children, and in adults there is a disease called osteomalacia. So वहाँ पे growing children में there can be bone deformities, वहाँ पैर टेढ़ा हो सकता है, हड्डी में दर्द हो सकता है, and in adults also they can have spontaneous fractures, bone pain. So all these things can happen. So the primary symptom is skeletal. On top of that, it's also essential that vitamin D be present for muscular function. The next symptom will be muscular. So there is sometimes weakness in getting up from squatting position. So अगर आप सोफे में बैठे हुए हो, उठने में दिक्कत हो रहा है, मसल का वीकनेस हो रहा है, हाथ रेस करने में ऊपर प्रॉब्लम हो रहा है, कुम करने में प्रॉब्लम हो रहा है, so we call proximal muscle weakness as another symptom. So primarily bone and muscle symptoms including tendency towards fracture can be present. Next symptom which will be slowly appearing somewhat in the later age can be related to vitamin D deficiency is osteoporosis. There are so many of us will have vitamin D deficiency and will not be having any symptoms. So ऐसा जरूरी नहीं है. So unless there is a frank vitamin D deficiency, maybe also there has to be a superadded component of calcium deficiency or some internal more disease. So we might have those frank symptoms. So it doesn't mean that if you are not having these symptoms, you don't have vitamin D deficiency and you don't need to and you don't need to take it from outside. So even if your reports are showing low, even if you haven't undergone a report, you should be taking some amount of vitamin D as your doctor prescribes. But and whether there are links to depression, there are links to malignancy, there are links to other mental health, links to immunity. So these are areas which are being studied. बहुत clear link नहीं है. So most of these vitamin D deficiency is most so common. So there is a association. But हम लोग लिंक तभी बोलते हैं, अच्छा विटामिन डी देने से डिप्रेशन ठीक हो सकता है कि नहीं. अगर if we look into those type of studies, most probably we don't have that much of data where we can say अच्छा नहीं विटामिन डी से डिप्रेशन ठीक हो जाएगा. There might be association studies, अच्छा विटामिन डी डिप्रेस्ड ग्रुप ऑफ इंडिविजुअल्स में ज्यादा है कि नहीं. आंसर होगा शायद हाँ, लेकिन विटामिन डी देने से वो डिप्रेशन ठीक हो सकता है कि नहीं, we do not have a straight answer for that.
जी, तो क्लियर कट कोई एसोसिएशन नहीं है कि जो भी व्यक्ति डिप्रेशन से ग्रसित है, उनमें विटामिन डी डेफिशिएंसी पाई जा सकती है, लेकिन ऐसा ज़रूरी नहीं कि विटामिन डी देने से उनका डिप्रेशन बिल्कुल गायब हो जाएगा। हाँ, मूड एलिवेटर जो है, वो ज़रूर हो सकता है उन लोगों के लिए जिनकी डेफिशिएंसी और डिप्रेशन थोड़े कम दर्जे का है। और सनलाइट भी जो है हमने देखा है कि एक मूड एलिवेटर होती है। यदि आप एक अंधेरे कमरे में एक नॉर्मल आदमी को भी रख लें, तो वो भी डिप्रेस्ड फ़ील करेंगे। तो सनलाइट बहुत-बहुत वाइटल है। मेबी देयर इज़ एन एसोसिएशन कि हाँ, सनलाइट से विटामिन डी बनता है, लेकिन अभी कोई प्रूवन स्टडीज़ नहीं है इसके बारे में। अब हम आते हैं कि डेफिशिएंसी के बारे में हमने जाना क्या-क्या सिम्पटम्स होते हैं। तो इसको अगर डेफिशिएंसी है तो किस फॉर्म में दिया जा सकता है? क्या ये हम एक टैबलेट के फॉर्म में, कैप्सूल के फॉर्म में, उसकी डोज़ क्या होनी चाहिए या फिर इंजेक्टेबल फॉर्म में लेना चाहिए? तो जिन लोगों को इंजेक्शन चाहिए, उन्हें इंजेक्शन क्यों लेना चाहिए? ऐसे कोई लोग हैं जिन्हें इंजेक्शन चाहिए विटामिन डी का?
See again, so in most of the formulations for adult in Indian setting, they इसमें 60,000 यूनिट विटामिन डी रहता है. तो वो 60 के फॉर्म प्रिपरेशन में आता है. तो इसमें there are sachets, which then we have liquids, we have capsules, we have tablets. So there are thousands, almost hundreds of preparations of vitamin D. It's so very common. Almost all the companies have some form of vitamin D preparation. So if the standard treatment which we follow, if somebody is having vitamin D deficiency, the treatment is like a weekly supplementation of any of this preparation. It can be a sachet, it can be a capsule, it can be a liquid preparation, it can be a tablet. So there are all sorts of preparation. Most of them contain 60,000 unit. So for initial correction, it should be like 60,000 unit once every week for 8 weeks. So after that, so the most common mistake is that you correct it and you then stop taking it. And if somebody gets tested after 4 months or 6 months or 8 months, it will invariably come low. So vitamin D is deficiency is so common. So we usually do not recommend even regular testing for that, because if you are not taking it, it will be invariably low. So only we recommend testing in some particular situation. If somebody is having some specific bone disease, somebody is having treatment for osteoporosis, somebody is having high complex calcium supplementation for kidney disease or liver disease, or there are some diseases like rickets, osteomalacia, parathyroid related problems. So there are specific bone related situations, or somebody is having some absorption problem. So gastrointestinal or hepatic problems. In those situations, only vitamin D testing is required. In most of the other cases of asymptomatic vitamin D deficiency, the recommended correction will be like a 60,000 unit supplement in any form for once every 8 weeks, followed by to maintain mahine mein ek tablet. So there are 2,000 unit preparations also, but taking a daily tablet adds on to the pill button. So it's a fat soluble vitamin. So if you're taking it in a 60,000 unit preparation once every month, it will get deposited in the fat tissue and will get slowly released from there. So from most of us will be quite comfortable in prescribing one tablet of or one capsule or one sachet of vitamin D 60,000 every month. No testing is required. That is the daily requirement, which it will be more or less close to our RDA recommended dietary allowance, and you can keep on taking it indefinitely. No requirement for testing, no requirement for additional calcium test, phosphate test. You can keep on taking it without any issue. Only, but sometimes we see that somebody is taking very high doses of vitamin D. That is not required. And again, a very important question, and that a very common myth is that you take a intramuscular injection that comes as a 6 lakh unit preparation, and that will get corrected early. So that is not the case. Intramuscular preparation will get deposited in the muscle and in the fat, and the vitamin D release will be more gradual. So if there are multiple studies which have shown that giving an intramuscular preparation has got no additional benefit over oral preparation. It's only recommended if somebody is having some absorption problem, किसी को कोई अच्छा कोई गैस्ट्रिक मेजर प्रॉब्लम है या इंटेस्टिनल प्रॉब्लम है, जैसे सीलियक डिजीज करके प्रॉब्लम है, प्रॉपरली विटामिन डी ओरल फूड से एब्जॉर्प्शन नहीं हो रहा है, और कोई मैल एब्जॉर्प्शन रिलेटेड डिसऑर्डर है. सो अगेन वेरी क्लियर मैसेज दैट injections do not have any advantage. It does not correct vitamin D earlier. So you only need to give vitamin D in a oral preparation, and after correction, a monthly dose of 60,000 unit indefinitely is totally safe, does not require any monitoring, does not require any test, and anybody can keep on taking it. Unless somebody is
Right.
having some calcium related problem, अच्छा किसी का calcium. So if somebody is having some bone disorders, you require monitoring of calcium, vitamin D, parathyroid hormone, phosphate parameters. In all other cases for asymptomatic individual, routine test में पता चला vitamin D low है, अच्छा 3 महीने के बाद दोबारा टेस्ट करते, 6 महीने के बाद करते, 1 साल बाद करते, not required. It's unnecessary. It will be low. It's expected. Just keep on taking 160,000 unit tablet. You don't need to do anything else.
जी, तो बहुत ही क्लियर मैसेज है. जिनको कोई अंडरलाइंग प्रॉब्लम्स नहीं है, लिवर की, किडनी की, बोन की, कैंसर की प्रॉब्लम, या कोई ऐसे मैल एब्जॉर्प्शन से रिलेटेड प्रॉब्लम जिनको कि खाना एसिमिलेट करने में प्रॉब्लम होती है, तो उन्हें बार बार विटामिन डी का टेस्ट नहीं कराना चाहिए. डेफिशिएंसी करेक्ट करने के लिए एक वीकली 60,000 जो यूनिट्स की कैप्सूल आती है, 8 हफ्ते के लिए ले लें, और फिर महीने में एक कैप्सूल जो है वो कंटिन्यू करें, ताकि आपकी जो मेंटेनेंस लेवल्स हैं वो बरकरार बनी रहे. इसका मतलब ये नहीं कि डेफिशिएंसी 8 हफ्ते में ठीक हो गई और आपका लेवल ठीक रहेगा, नहीं, उसको मेंटेन करने के लिए वो दवा ना छोड़ें। बहुत कॉमनली हम देखते हैं कि लोग ये चीज़ बंद कर देते हैं। अंकुर सिंह जी का एक क्वेश्चन है, ये रिलेटेड क्वेश्चन है। माय मदर इज सफरिंग फ्रॉम ऑस्टियोपोरोसिस, शी इज टेकिंग 1 इंजेक्शन डेली for 3 months. Most probably I'm considering it should be vitamin D, but there is no improvement. बहुत ही कॉमन सवाल है ये कि ऑस्टियोपोरोसिस जो है उसको ट्रीटमेंट के तौर पे अगर विटामिन डी चल रही है तो क्या वो ठीक हो जाएगा?
See, vitamin D, osteoporosis is a disease where the bones get weak, and uska jo because of osteoporosis there is an increased tendency for fracture. So vitamin D and calcium supplements, these are considered as supplemental treatment for osteoporosis. So anybody not without osteoporosis also will require some amount of vitamin D. So giving extra vitamin D through injection is not going to have any beneficial effect on osteoporosis. So agar osteoporosis hai, you need to consult an endocrinologist or maybe an orthopedician. But for medical treatment of osteoporosis, endocrinologist is usually the person who is more specialized, and where you can so there are other forms of therapy which can be oral, which can be in form of a daily injection, which can be in form of a 6 monthly injection, or even there are annual injections, but those are not vitamin D injections. So if you are giving vitamin D injections 6 lakh unit every 3 months, I need to cross check with an endocrinologist whether that is the correct treatment or not. And after that, if the endocrinologist or whoever is your treating doctor is suggesting that that should be the treatment, you can consider it. But as of now, whatever I am getting to understand from your whatever information I have, so the vitamin D 3 monthly is not the treatment for osteoporosis. It's just a supplement, and the supplemental dose will again be, so any form of treatment of osteoporosis, you need to give at least 2000 unit of vitamin D every day. That is again equivalent to 60k once every month, and you need to give around 1200 mg of elemental calcium. It can be through diet, it can be through a calcium tablet or 2 calcium tablets. So these are 2 supplements which is part of all osteoporosis treatment. But this is not osteoporosis treatment, this is just supportive. You need to give proper treatment for osteoporosis if somebody is having that.
जी, तो ऑस्टियोपोरोसिस का ट्रीटमेंट जो है वो विटामिन डी के अलावा कई और चीज़ें हो सकती हैं। आप एक एंडोक्रिनोलॉजिस्ट से मिल सकते हैं जो ऑस्टियोपोरोसिस के मेडिकल स्पेशलिस्ट होते हैं, जो आपके डाउट्स क्लियर करेंगे। सोनिया खुराना हैज़ अ क्वेश्चन। शी सेज शी हैज़ बैक पेन और नेक पेन जो कि बहुत जल्दी हो रहा है। सो व्हाट शुड शी डू?
See again, so if
डॉक्टर
somebody is having back
भट्टाचार्य।
pain or neck pain, so there is a component of which can be partly improved with calcium and vitamin D supplementation. But again, there are other factors which need to be looked into and which might not get corrected by vitamin D alone. So if somebody is having a slip disc, if somebody is having cervical spondylosis, if somebody is having some degenerative changes, so these are conditions as which can increase the risk of pain. So that has to be seen by an orthopedician or a spine surgeon, and at appropriate treatment should be planned according to that. So obviously, for all bone conditions, supplemental calcium and vitamin D is going to help. Vitamin D might partly help if there is a strong, if there is a overt vitamin D deficiency, but it might not be the only solution. So if in spite of supplementing calcium and vitamin D, if the pain is persisting, we need to look for other causes.
जी, डॉक्टर भट्टाचार्य, हम अपने जवाब जो हैं बहुत शॉर्ट रखेंगे, काफ़ी सारे सवाल हमें लेने हैं। तो सोनिया जी, नेक पेन और बैक पेन के कारण बहुत हो सकते हैं, केवल विटामिन डी नहीं, तो डॉक्टर को ज़रूर दिखाएँ। दिव्या छाबरा आहूजा हमारे साथ हैं। शी हैज़ अ क्वेश्चन, हाउ सेफ इज़ टू टेक ऑस्टियोनिन नेज़ल स्प्रे? इज़ इट ओके टू यूज़ इट डेली इवन इफ somebody is taking tablet Tayo weekly?
सो अगेन नेजल स्प्रे, एक कैल्सिटोनिन करके नेजल स्प्रे आता है जो ऑस्टियोनिन का कंपोनेंट है. सो दैट इज considered as a treatment for osteoporosis, but usually that is not recommended as a long term treatment. So अगर किसी को acute severe spine pain है or bone pain है, calcitonin nasal spray can provide short term relief, but most or mostly all international guidelines and Indian guidelines or WHO does not recommend long-term calcitonin as a treatment for osteoporosis anymore. So that should not be continued for more than 5 days or 7 days. So it does not have any benefit. If you are taking, you need to discuss it again with your treating physician or an endocrinologist.
Thank you for that answer. We have Dr. N.S. Sharda with us. Thank you, sir, for joining. He regards from both of us to you also. He says, what is the daily dosage of vitamin D if somebody wants to take it daily?
So usually there are tablets of 2000 units which are available. Even some of the calcium supplements will have 1000 unit of vitamin D in it. So if we go by standard textbook teaching, it's around 800 to 1000 unit. But what we see practically in almost all, that the daily requirement to maintain the vitamin D levels is around at least 2000 unit. So if you are planning to take vitamin D on a daily basis, that will be at least 2000 unit every day, because even 1000 unit in our setup, we clearly see that it's not able to maintain the levels of vitamin D. So it should be at least 2000 unit if you are taking a daily supplementation.
Right. So we have very important question coming in again. One from Manu Sharma, another from Dr. Varuna Singh. They want to know the dose and dosage of vitamin D in children.
So again, it depends on the age. So we start with around 400, then we go up to 600. So that is the usual recommended dose for in the early part. So it will grow. So if somebody is more than 12, so it will go near the adult part. Again, maybe whatever is the standard recommendation, we tend to give a slightly higher dose, because in Indian setup, what we see, the levels are not getting maintained. So anything between six, maybe if somebody is less than 400 units every day. Once more than 1 year, it can go up to 600 or 800. If somebody is around say 6 or 8 years, so this is only for maintenance. If you have deficiency, again it has to be corrected by a larger dose. Then for maintenance, it will be like anywhere between 600, 800 or 1000.
So in children, we usually give it every day, which is what you mean.
At least for infants, we give it every day in a drop formulation. We do not give a bolus preparation. But again, if somebody gives, there is nothing wrong. But most of the guidelines will recommend a 400 unit of vitamin D every day.
Chandan Chaudhary ji ka question hai. He says he's HLA-B27 positive. एंड इनका मेडिकल प्रोटोकॉल क्या होगा, फिजियोथेरेपी ट्रीटमेंट क्या होगा, प्लीज थोड़ा सा बता दीजिए.
See, HLA-B27 positivity can be a marker of ankylosing spondylitis and other rheumatological disorders. So it all just HLA-B27 positivity does not require any treatment. But if you have any other associated condition because of HLA-B27, which can be, there are several, three, four, five, or other variants of rheumatological disease which can be associated with it. If you have any of this condition, you need to consult a rheumatologist for that.
Ramesh Chandra Pandey ji has a question. At the age of 67, I am having a lot of cramps in different part of the muscles. I am a vegetarian. Should I start over-the-counter preparations available? And one of the persons which I remember had asked a question that they are vegetarian. Is there any good source of vegetarian diet which they can include to increase the amount of vitamin D in their diet?
So again, so food source, vegetarian, sun-dried mushroom is the only source. For if some milk or juices are fortified with vitamin D, that can be taken. So vitamin D is present in two forms. One is vitamin D3, which is the animal form, and there is a plant form which is vitamin D2. So most of the tablets will will contain the animal form of vitamin D, which is vitamin D3 or cholecalciferol. So if somebody for some religious reasons wants to take vitamin D2, they're usually not available in the pharmacies in most of the in most cases. So they are sometimes available online. If you request a pharmacy, they might procure it. So it's slightly costlier. The cost goes up. So a vitamin D tablet will be like 10, 15, 20, or maximum 30 rupees. So that will be enough for a month. But if you're planning to take vitamin D2, that will slightly come as a costlier tablet, but again, it's available. So there are two aspects. Most of the vitamin D plant source will not have enough vitamin D. Fortified mushroom, you need to take a lot of it if you want to take it through only food. Some of the so sun-dried mushroom is one form, and the others will be like fortified preparation. Or you need to take a vitamin D2 tablet, which is argocalciferol, which is available.
Right. So Nitin M. Mehta has another question. इनका सवाल है, can vitamin D deficiency lead to disturbed thyroid function? Also, he was the one who was asking about the vegetarian part of vitamin D, which you have already explained. So he wants to know, can vitamin D deficiency lead to disturbed thyroid function?
See, there are. I want to give a more general answer for it because this is a very commonly asked question. So there are some specific conditions which have a clear association and we see benefit by giving vitamin D: bone health, muscle strength, and tendency for fall. So these are three things which tendency for fall also because of muscle weakness. So these three clear and osteoporosis. These are things which clearly benefit from vitamin D supplementation. Give this medicine, follow them on long term, there is a benefit. There are lots of other things, including thyroid, other autoimmune disorders, multiple sclerosis, malignancies, inflammatory disorders, infections. They all have associations. You have a group of people with vitamin D, nor say rather it's done in the other way. So if you see a group of people with vitamin D deficiency, you will see that they are all having associations.
A lot of problems with the signal. Sometimes we are losing Dr. Bhattacharya. I am sure that he's going to be here again. Till then, we'll take some of the other parts of the questions. The next question, which I am going to ask him, is from Aprajita Singh. Dr. Bhattacharya. So Miss Singh is asking, her vitamin D level is 24. Does she need to have a supplement or exposure to sunlight would do? Miss Singh, we have already discussed this question. हमने पहले भी ये चीज डिस्कस करी है कि जो हमारी विटामिन की रिक्वायरमेंट है इंडियन सन और एक्सपोजर से कई बार वो जो है पूरी नहीं हो पाती और 24 जो लेवल है वो कम मानी जाती है। एक अच्छी लेवल ऑफ विटामिन डी जो है वो 70 टू 80 के करीब होती है। आपकी लेवल कम जरूर है और सनलाइट का जो एक्सपोजर चाहिए इंडियन सन में वो बिटवीन 4 to 6 आवर्स मॉर्निंग आवर्स में चाहिए होता है और पूरी बॉडी को एक्सपोज करने की जरूरत पड़ती है इतना लेवल ऑफ विटामिन डी जो है बनाने के लिए। और इंडियन स्किन का कलर जो है बहुत अलग है वेस्टर्न स्किन से, उनका बहुत जल्दी बन जाता है, हमारा नहीं बनता, इसलिए सप्लीमेंट लेना जरूरी है। डॉक्टर भट्टाचार्य बता चुके हैं कि इसका डोज जो होता है 60,000 यूनिट्स की जो कैप्सूल आती है, यदि किसी को डेफिशिएंसी है तो वीकली वो ले ले, 8 हफ्ते के लिए लेते रहें और उसके बाद मंथली उसी कैप्सूल को जो है आप कंटिन्यू कर सकते हैं। Sorry, we lost you in between, Dr. Bhattacharya. We have few other questions which we are going to take, and Mr. Kaushik Bhattacharya has a question. Maybe he didn't understand the difference between D2 and D3. So you need to explain what is the difference between D2 and D3.
So I would just like to finish what I was telling that. So related to the other conditions like autoimmunity, thyroid disorder, malignancy, neurological disorders, memory. So all these things we have association. It's more common in vitamin D deficiency states, but when we try to give vitamin D and try to as a treatment for that condition, we do not see that it has a cause and effect relationship. So it does not usually supplementing vitamin D does not usually correct the condition. So maybe vitamin D will make some changes which predispose us to some particular diseases, but giving vitamin D alone might not be the only solution. So again, these are association, but we need more data to understand whether thyroid is related to vitamin D deficiency, or a particular neurological problem or a memory disorder is related to vitamin D deficiency. So these are all in being studied, but we do not have a clear answer for the other conditions. For vitamin D2 and vitamin D3, so vitamin D2 is called argocalciferol. So it's a plant form of vitamin D2. So it's obtained from a plant source. And there is vitamin D3, which is the animal form of vitamin D3, which is called cholecalciferol. So most of the preparations which you are getting over the counter or your doctor is writing, most of them will contain the animal form. So if for some reason you want to take the plant form only, so you have to, there are some formulations which are available, slightly costlier. Most of them will contain around 500 units. So you need to take at least 1 or 2 to 3 tablets, or maybe 4 tablets of those, and the cost will go up higher. But again, that is available. So the efficacy is almost same. There is no difference in the work of plant-based or animal-based vitamin D. At same dose, they will cause the same benefit, but the cost of treatment or the number of tablets might go up slightly. Dr. Vinny, you are muted again. Dr. Vinny, you are muted.
Ms. Divya has a question she wants to ask. Can vitamin D deficiency lead to locomotor disability in a child aged 12 having flat feet? The child has difficulty walking. Is it curable with medicines?
So if vitamin D deficiency can cause frank rickets, that can cause bone pain, sometimes fracture, bone deformity, that can cause muscle weakness. But so unless it has produced any severe deformity, majority of it will be correctable. The muscle function will improve. But sometimes we see some deformities which have progressed to a stage where that might not be reversible anymore. So might require some orthopedic interventions in that after correction of vitamin D status. So yes, it can cause locomotor disturbance, but after correcting of vitamin D deficiency, if the condition is still persisting, then you need to consult a neurologist, whether vitamin D or a pediatric neurologist, whether vitamin D alone was responsible or there was some other secondary cause on addition to vitamin D. So vitamin D will be low in most cases if somebody is not on supplements. But whether that is actually responsible, so also you need to look into other parameters, like if it's rickets, the calcium values will go down, the phosphate values will go down. Then there are some parameters like alkaline phosphatase that will go up. Even there are hormones like parathyroid hormone that will go up. So these are changes which will also suggest that how severe the vitamin D deficiency is, and whether this is alone causing or there are other factors to it.
Right. Monica Suneja has a question. She says they are 44, they have pain in joints. What do you suggest? I mean, which tablet and
Again,
how?
osteoarthritis has got some connection to vitamin D, but again, might not be the only factor responsible for it. So, even at the age of 40, 45, 40, 50, 50s, there are degenerative changes which set in, and vitamin D will again correct part of it. But if it's again, it's not the only treatment for osteoarthritis. So if you are talking about joint disease, so the commonest cause will be osteoarthritis. That is like an age-related degeneration. Often can set in slightly early at 40, 45. Also more common in older age. There are other forms of arthritis also, which are like inflammatory arthritis, like rheumatoid arthritis. So you again, vitamin D is one component of it, not the only component. There are other factors to it also, and those also need to be treated in discussion with your doctor.
Nidhi Sharma wants to ask, can vitamin D deficiency cause sleepiness?
So unless again, I won't ascribe vitamin D deficiency to sleepiness. So most probably, if somebody is having that severe vitamin D deficiency, that the calcium level has really gone down and it's causing some neurological problems. We do get to see some cases like that. Then there will be other overt manifestations of vitamin D deficiency also. So it's not a standard reason behind increased sleepiness. If somebody is having sleepiness, I think Dr. Vinny might help more. We need to rule out obstructive sleep apnea.
Right. So Dr. N.S. Sharda has a good question. He is asking, we spoke about the role of vitamin D in, immunity. And he says in COVID pandemic, vitamin D and B12 gave good results in recovery. So what is the role of vitamin D in COVID-19 disease per se? And also, can it lead to toxicity?
So again, two very important questions. So vitamin D, even there are associations with even associations with tuberculosis, association with infections in the ICU, association with mortality in ICU. So if somebody is deficient in vitamin D, so you correct that deficiency, it will definitely help. But again, if somebody was already was taking vitamin D earlier, already had a normal vitamin D levels, so most probably giving additional vitamin D as a therapeutic modality is not going to help. So those who benefited were vitamin D deficient. Deficiency of vitamin D, there are it has a it alters the immunity, it decreases the response to infection, and giving vitamin D might correct that part. So since we are all deficient, somebody is given vitamin D, so that part will get corrected. Somebody already correct has a right store of vitamin D, you give additional vitamin D, it's not going to help. So this is again not a treatment for COVID, but since everybody is deficient, giving it might help. The other question, what was the second question? If you could tell
The
me, Dr. V.
toxicity if somebody is taking indefinitely or
That is a
overdose.
very important concern. So there are sometimes prescription errors. So somebody is taking vitamin D on a daily basis, 10 days of continuous vitamin D, or very frequent alternate day injections which contain 6 lakhs of unit. So vitamin D levels can go up. So if you are getting vitamin D 60,000 once every month, there is no question of toxicity. It cannot happen. But if somebody is given very high doses beyond whatever we have been discussing for last 30 minutes or 45 minutes, so very high doses of vitamin D can cause toxicity. It can cause the calcium levels to go up. High calcium has multiple negative impact, including damage to kidney. So you should be, if you have any confusion, please consult your doctor, get the right dose of vitamin D. I'm not suggesting that everybody should start self-prescribing vitamin D on their own. So if you're taking a vitamin D on a monthly basis, maybe you can take it on your own. You can even if you have any confusion, you can consult your doctor.
I think we
Very,
lost
very
Dr. Bhattacharya again. You can
again.
switch off your camera if the signal is weak, so
Okay.
that way
So
we
if
will
you're
be able to hear you.
okay, if it goes again next time, I'll switch off. So if the vitamin D level is grossly low, you can consult a doctor for the first time. Once that gets corrected for maintenance, you can take it on your own.
Right. Jagdeep Kaur has a question which I am partially able to understand. So they say, ma'am, multiple bone hereditary, possibly fractures. I don't know what she wants to say. In age 3 years old baby, how to recover?
So again, frank rickets is known if somebody is very deficient in vitamin D as well as calcium, and maybe there will be component of protein deficiency as well. So that can cause all these things. But we more or less everybody is well read about vitamin D. So we do see fractures and frank cases of rickets, but it's getting uncommon. Thankfully, it's getting uncommon. So, and I'm sure the vitamin D levels must have been corrected by now, and you must have met a pediatrician or an orthopedician who must have given you the right treatment. So again, vitamin D can be responsible, but we just because we should not be attributing everything to vitamin D. So you need to consult the doctor, rule out other causes of bone fractures. There are multiple genetic factors. There are calcium related genetic diseases, phosphate related genetic diseases. So all these things need to be addressed before we just ascribe or attribute everything to vitamin D. So that is common, that is responsible for many things, but that is not the answer to everything.
Girja Shankar Sinha ji, if you go to the previous part of our talk, you will be able to understand that Dr. Bhattacharya has suggested any of these forms, which could be a sachet tablet or a chewable liquid or softule could be used. All of them are very very effective and can correct the deficiency. Dr. Bhattacharya, thank you so much for connecting with us
Again,
and
I would like
discussing.
to just a small comment before leaving. So there are some activated forms of vitamin D also which are present in the calcium tablets. So that can increase the toxicity as well. So again, we should not be taking blindly calcium supplements with activated forms of vitamin D. So if you are taking vitamin D, it's better to take as a day monthly tablet of a 60,000 unit for maintenance. So some calcium supplements containing activated vitamin D, chance of toxicity, chances of renal stone formation that can actually go up. But but if you are giving it in the way we discussed, the chances of toxicity are very less.
Right. So, thank you so much for connecting to us and giving us so much of information in such a short span of time and increasing our knowledge. We are very, very happy that we have covered all aspects of vitamin D. So, thank you so much for sparing time with us. We have a very small little gift for you. This is a certificate of honor, which that you have spent your time with us and come as a distinguished speaker on the show, which is Dr. KK's Med Talks, in which we come every day and discuss some health related issues. Thank you so much, everybody, for connecting with us. Today, we take a leave. We will be meeting you very soon again tomorrow. Till then, Jai Hind and good evening.